I would like to introduce Jennifer Carpenteri from Atlantic Health System, and she will present on mental health and COVID through an integrated lens. Thank you for being here today, Jen.
Thank you. And please forgive me for a moment because I'm trying to figure out how to share the PowerPoint instead of everything else that I'm working on. Here we go. I think we have got it. Okay.
You go.
Give me one moment. I will try to put this in the appropriate.
There you go.
Okay. Well,
and that's why this is a meeting, and we're all here just to chat, learn.
Yes, and I think anybody who knows me knows that I'm informal. I can be formal when we need to, but I really am informal and love the interaction and love the conversation. That's really what we're here to do today, is to conversate and really take a look at the overall needs that we have in our communities from that integrated lens. As Laura shared, I always kind of put this out there. It's a sad reality, but one I need to. I am a COVID long hauler, so please forgive me if it takes a few minutes for me to find a word, or if I stumble on something. I will eventually get it. And sometimes I use my hands and it's playing charades. So, you know, forgive that. But today we really are here as a follow-up to our first forum, which is great, and I was so thrilled. We really had a wonderful and robust conversation and presentation on the overall mental health needs of our communities, and so we tackled a lot of overarching mental health needs, but what we didn't get to, and the populations that the participants really felt we needed to kind of come back and continue the conversation on, and look at a little more deeply, were seniors, youth, and families, and substance use disorders. So today, those are the three special populations that we're going to really talk about. I think it goes without saying that as providers, as part of the North Jersey Collaborative, when we talk about us and how we want to be represented in the community and what our goals are and our missions of our work, it really is to be that trusted resource for the people that we serve and connect them to help that they need. And I will say it, you know, time and time again, that our communities and the partnerships and the incredible and diverse work and services that we do together is simply mind-boggling sometimes when you think about all of the things that happen within our agencies and our networks. And so we need to look at mental health and how today are we ensuring that there is care and that there's a place where every individual can access the services that they need as a whole, right? You know, sometimes I lovingly and jokingly say, you know, when you go to the doctor, you go to certain to get certain care. It's like, okay, well, we could treat your hand here, and we could treat your knee here, and we could treat your leg there, but ooh, that mental health thing, that's a different building. So, you know, so how do we as a community really improve that access to care, reduce fragmentation, and again, improve the quality of life for those that we serve, right? So not having 8 doors that need to be knocked on before we get services. How do we coordinate and collaborate to get people to where they need to go? And so I want to just recap from the prior forum that we did, just a couple of highlights that I would like to make sure that everybody is aware of. Mental Health America has really some really great resources on their website, and one of them are these screening tools that they have. You know, since the pandemic, we know, excuse me, that people are really talking about mental health more, which is that silver lining that we'll talk about today. We really need some silver linings here, and I think this is one of them. You know, and while people are talking about mental health, I think people are still very confused and don't exactly know where to go and how to reach out. I think it still feels very complicated and out of reach for people. And so Mental Health America really does have some nice resources that they can go to and kind of really have some self-reflection and also use these tools to see if they do need to reach out to local healthcare providers. And I wanted to share this one quote that I love quotes, and this one really kind of stood out to me. And it says, life can be challenging, but every day shouldn't feel hard or out of control. If it does, one of the quickest and easiest ways to determine whether you are experiencing symptoms of a mental health condition is to take the mental health screening. So, you know, every day is a challenge, okay, but you shouldn't be feeling like it's out of control. So I want to make sure that everybody is aware of this resource and can access it. Next, I took a summary of some of what I think are really important lessons and messages that we could take away from the past couple of years. And caring for our mental health is critical, not just for those we serve, but for ourselves and our families. So what have we learned, right? That we really need to make mental health a priority. And sharing our lives in person or virtually with friends or family, experiencing new hobbies, talking to people, having new experiences, really helps us to be hopeful and resilient. I think hope, you know, resilient, everybody's talking about resiliency, right? I'm sure everybody has heard that word a million times. But I hope you come away with the word hope stuck in your mind. You know, hope is something that's fragile, and it's okay to have to reach out to somebody as a professional to talk through if hope is really waning for you, or like that quote said, if you're really struggling and feeling out of control every day. I think the silver lining is from the pandemic is that people have learned that it's okay to reach out for professional help, and I love this, that it's really not as scary as previously thought. You know, people didn't know what to expect. They really thought weird things about, you know, reaching out and talking. And so I've heard a lot that it's really not as scary. And so I encourage all of you, and I really hope that each and every one of you will take the challenge, if you will, that I present today, and start talking out loud about mental health. You know, it's always been something that's been whispered about or not discussed. And we really can't deny any longer how important mental health is to our overall health, and that we really need to talk about it. So encouraging the speak and encouraging safe places for people to have those conversations is critical. Again, what have we learned? Steps to building resiliency and good mental health: good sleep hygiene, talking to your doctor if you're not sleeping well. Really key points. Sleep can be really mind altering if it's not happening. Keeping things in perspective. Remember, other hard times have fallen upon every single one of us. We have all struggled with something, and you've gotten through it, right? So learn those strengths that got you through it in the past, and really build on them, right? Lean into your strengths, build on them, write them down, write things that you're good at. What have you accomplished? You know, be kind to yourself. Don't be humble. You know, really kind of dig down deep and find those things that are your strengths and have gotten you through difficult times, and give yourself credit for that. find those social connections, right? How important have they been for us? Reach out to family, friends, uh, groups online that have similar interests. Technology, right? If you can't have real in-person visits, use that technology. And I know a lot of us, we work hard, and it's that saying, work hard, play hard. Make time to play, make time for yourselves and for quality time with your families. It's also important for us to pay attention how our mental health can make us move forward towards good health, right? Sometimes you may just need somebody to cry with, to vent with, just get it out. And getting that support from somebody is so important. It could be a friend, it could be family, it could be a professional, it could be a spiritual advisor, anybody that you feel comfortable with and is a support to you. It's really important to know who those people are and have them on speed dial when you need them, because it's incredibly important to have support, even if it's one person that you can talk to. And sometimes having that professional help guide us in with their clinical skills or tools or medication if that's needed, right? Learning those new coping skills, learning how to grieve, learning how to bounce back. We've gone through hard stuff, and this stuff is hard. It's not just the pandemic, it's a lot going on. We've got wars, we've got political issues, we've got social unrest. There's so much going on. So find those connections and know them in your head. So when you need them, you can access those, because again, hope and it's okay to get help are two things I want you to take away with you today. When we're under too much stress, we can turn to coping skills that really were good, but maybe overdoing them can cause some harm, right? Drinking too much, shopping too much. It's a way to numb ourselves out, right? I know for me, I scroll at night. I should probably not be doing that because Amazon then shows up the next day and it causes problems for me. But eating, right? Drinking, some we'll talk about it today. The pandemic has led a lot of people to look at having a drink or utilizing substances as a coping mechanism. And again, something that's good for you can truly end up as a negative. So good mental health support can really get us back on track and can really help us cope with all of the pain and the struggles that we're dealing with. And I think it's incredibly important that we need to take the time to grieve over the losses of the past. I have 2 years here, but it's outdated now, and it's probably more 3 and 3 plus. Too much social distancing is not good for our health in any which way, right? It leads to loneliness, isolation, and sometimes depression. And so really trying to find those safe places and find those people to connect and to have those moments where you allow yourself to be vulnerable and you allow yourself to talk and grieve are super, super important. And one thing I forgot, don't watch too much social media or and the news 24/7. You will find things to perseverate about and cause you stress. Get your news from whichever source that you feel is trusted, and don't binge on it. Don't overdo it. There's too much going on, and it can really be taxing on our hearts and on our mental health. So everyone we know should have the supports we need to thrive, right? There's often no one single cause for a mental health condition. Instead, there's tons of different possible risk factors that can influence how likely a person is to experience a mental health issue, and also how serious the symptoms could become. So we'll talk about some risk factors for mental health conditions today, which include trauma. Again, trauma could be a one-time event or an ongoing event, your environment, how it impacts you, and the health and the quality of your life. A lot of us are very familiar with the term social determinants of health. And this is something that can be your financial stability. It could be access to healthcare. It could be food insecurity. It could be many, many things, housing, transportation, the list goes on. These are things that we as a system need to look at and learn how to communicate with each other so that we then start filling the gaps and connecting our folks to the services that will, again, overall make their lives better, improve their quality of life, and make our communities healthier. So let's take a look at the impact of COVID. I think overall, I mentioned that, we have to grieve our losses in COVID. And I had a slide, but I said, let's keep it here. I don't want to bore the people who are here for part 2 and have already gone through the program. But for those of you who haven't, really everybody has lost something in these past few months, whether it's a person you love, which for me has been a person I love, my health. It has been the loss of freedom, right? Loss of control. We have lost the sense of predictability. We could say we've lost, our cultural norms and traditions. How many people didn't get their graduation or to go to prom the way that they thought would be the milestone for them? So there are a lot of different ways that losses can be looked at for all of us. And so we need to just take a moment to say we've lost something, right? Control, expectations, and a loss of what once was. And so common reactions to that are irritability, right? Increase or a reduction in your sleep or your appetite, right? Some people question faith or religion. Forgetfulness, that's me. Loneliness, disbelief, panic, anxiety, fear, sadness, disappointment, sometimes feeling numb, right? Denial, confusion, not knowing what you should feel or if what you're feeling is normal. Could be obsessiveness, guilt. This list can go on and on and on. And each person is going to react differently to grief and loss. And again, it is okay and it's actually expected, because it's important for everybody to take that moment to reflect and what's going on inside. And whatever that is okay. And to understand those short and long-term impacts on your life, more often than not, it's going to be in more than one life domain. It could be in several. And so how can we, as a system, coordinate our responses to those myriad of service needs? How do we let our clients and participants and consumers, how do we let those we serve know that it's okay, and to connect them in those directions? And so today, one of the populations that was requested, and we're going to talk a little bit about, is senior. Let's start with seniors, right? One of my favorite populations. I was doing a lot of research, and to be honest, AARP had a really great website and fact sheet that I really liked. And so I think they kind of bring things together. They took these 2 studies that they did in 2021, and they compiled the information nicely. And so these next few slides are going to talk through some of those findings. And so, excuse me, what they found was that although the vast majority of older adults say that they have experienced the decline in their emotional well-being, only 1 in 8 say they sought help from a mental health professional, right? The disconnect between experiencing a decline in emotional well-being and the likelihood of seeking help from a mental health provider really does suggest, or may suggest, that older adults don't associate emotional well-being with the term mental health. And I've heard that from a lot of different organizations that I've worked with who are senior serving, and that really that word mental health doesn't really resonate with seniors, and that while it's understandable that older adults would see a decline in some of those mental health and emotional well-being during this trying time, it's not a normal part of the aging process. Some people say, well, you know, they get lonely, they get depressed as they get older. Not so much, they're saying. And to combat the possible hesitation on the part of older adults, access to mental health treatment must be easy, seamless, and normalized, ensuring that mental health and emotional well-being are addressed during all those medical visits that they may go to. And using those medical visits is really an invaluable step towards ensuring older adults receive comprehensive care. And I thought that was really important for us to take a look at today, as we are that North Jersey Health Collaborative. Some interesting stats that I wanted to bring forth is, when asked about mental health, most older adults ages 50 plus say their mental health is very good. However, over 6 in 10, 65% of older adults ages 50 to 80 rated their mental health as excellent or very good, and over a quarter rated their health as good. However, when asked about specific emotional health measures, we find half or more of the older adults ages 50 and older say in the past 2 weeks they've been bothered with these below symptoms: difficulty falling asleep or staying asleep, feeling anxious about things, right? 56% had difficulty sleeping, 49 feeling anxious about things, right? 37% had little interest in pleasure in doing things, which is a concern. And again, 32% reported feeling down, depressed, or hopeless. So even though they feel and acknowledge and report that their mental health is good, the indicators of what constitutes healthy emotional health really are not as good as they may say. And the majority of those adults ages 50 and older say that the pandemic has increased their level of concern about the future, 77%. General worry, 76%. And similarly, 7 in 10 say they had increased level of depression and anxiety. Half of the 50 plus say the pandemic has increased their level of anger in general. These findings are supported by recent results from the National Poll on Healthy Aging, which I thought was important. And they found that many older adults ages 50 to 80 report experiencing worse depression or sadness, anxiety, and worry since the start of the pandemic. So I think that these statistics and data really, again, support the fact that the words that we use and the language that we use and who and how we're talking to seniors about mental health really are critical. And so again, they have a really nice visual about what older adults say what they do now as coping skills versus pre-pandemic. And you can see that 27%. So while some of the coping skills are good, some may not be as healthy. And so good one, 27% meditate or pray. 25% are eating unhealthy foods, candy, chips. It's a downfall. 22% are eating comfort foods. Some may be healthy, some may other. 19% are sleeping more and napping. 11% are taking herbal products or dietary supplements to relieve stress and relax and sleep. A little iffy. And 10% overact or lose control. And that was interesting. Another statistic is that women are significantly more likely than men to say, compared to before the pandemic, that they do more meditating, more eating of unhealthy foods or comfort foods, or taking more of those supplements. And again, although the vast majority of adults say they have experienced a decline in their emotional well-being, only 1 in 8 are seeking help from a mental health professional. And a third, which is 32%, of those who sought help from a mental health professional in the past year say they sought help as a result of the pandemic, right? So all of these statistics really kind of, I thought, show that the senior population really needs a different kind of approach, and a very targeted approach, utilizing terms and phrases that help them identify signs and symptoms really more than mental health. I think they will identify much more with that approach. I'm going to, are there questions in the chat? I want to just go into the chat real quick. Are there questions? Oh, I see some resources. Will the PowerPoint be shared? I can share. Okay, so I just want to make sure that I'm being responsive if there's questions or thoughts or additions. We're going to open it up in just a few moments when we go through some of the statistics that I thought would be helpful for us. And so let's talk a little bit about the impact on mental health, youth and families, right? Without going through a ton of numbers. Research confirms that children and adolescents are experiencing significant anxiety and depression, and that during the pandemic, adolescents may be at greater risk, particularly females, for social isolation, loneliness, lack of physical exercise, and physical stress may be contributing to these problems. Children who feel unsafe in regards to the pandemic may truly be more likely to experience somatic symptoms, headaches, physical tummy aches, things of that nature. Depression and anxiety, parental stress, and mental health problems may put children at an increased risk for maltreatment. And the, again, important message for us as a medical community, healthcare systems, community partners, is that the medical and behavioral health professionals should routinely screen and check for depression and anxiety with children and families, because it is most definitely on the rise. I think we can all, I know that in the chat someone shared about the documentary that started last night on PBS, Hiding in Plain Sight. My husband and I were watching, and we'll watch again tonight. It was fantastic. There are so many resources out there and so many different clips really talking about the mental health crisis that we are in. And I was going to put a video in, and I said, I'd rather talk. I think people can go and look at those resources on your own. But I think there are so many ways that you can look at how the pandemic has impacted our children and our families. And so just a few ways that everyday life for children has been disrupted, and are now particular stressors for children and adolescents are, again, the increased social isolation, heightened concerns over safety and health, increased stress of parents and caregivers going to work, financial and other impacts, increased family conflict, parent-child conflict or child abuse, unfortunately, a placement with friends or relatives while parents are going to work and needing to financially support the family. loss of pro-social activities, right? Sports, schools, all, hobbies, everything has been uprooted, and we're starting to see them come back. But again, having the disruptions has created anxiety and stress. And what does it look like going back? And some kids are just going for the first time where they may have gone several years prior. So it's an adjustment and a loss for everybody. Adjusting to online schooling, right? The demands of that, some kids flourished and some kids really floundered, and we're still trying to catch up for that. The increased screen time, sedentary behaviors, it's become a problem, not just with addiction to screen time and weight gain, but health issues that come along with that, and decreased access to medical and mental health care, including exacerbated health disparities. We all know that the demands are high and the resources are constrained. So really kind of looking at all of these stressors that all of our kids and our families as a family system are going through, it's overwhelming sometimes. And sometimes we have to take them bit by bit, one at a time. If things become overwhelming, again, start, make a list, prioritize, and start there. Because again, it could be overwhelming, not just for the kids, but for the parents trying to navigate their own emotions and future needs and goals, but for the kids and with them as well. I thought this would just be a good visual to talk about really how the kids by age group are faring. You know, younger kids are a little bit more clingy, have more fear about safety, increased uncooperative or worried behaviors, boredom, needing attention, anxiety, and young children of those people who, the hourly service workers who experienced such a loss and had to really really experience so many losses during the pandemic. I think those children have really been hit in a very powerful way. School age children, right? Anxiety and depression are being reported as higher than normal. Rates of significant depression symptoms in studies have ranged from 2.2 to almost 12% increases. Rates of significant anxiety symptoms can be as high as almost 24%. The rate of PTSD being reported again is much higher. And some of the most problematic behaviors for these age children are that increased inattention, the need for reassurance, difficulties with academics, misbehavior, anxiety, social isolation, and depression. Again, common themes here, right? And for adolescents, parents have really reported a lot of those depression and anxiety, misbehavior, poor attention. The impulsivity is a big one as well. Now, self-reports from the adolescents acknowledge significant anxiety symptoms and can range as high as almost 30% higher, right? Rates of significant depressive symptoms can range up to almost 22% higher. And they were found higher in female adolescents compared to males. Several studies indicated that high school seniors compared to the lower grade students demonstrated the highest ratings for depression and anxiety. Whoops, I'm so sorry. And mental health related emergency department visits were more common in the 12 to 17 range post pandemic, and with females having a higher proportion of visits. And can't forget the college students, right? They're still adolescents, most of them. Almost 40% reported symptoms of internalizing disorders, which are depression or anxiety. Almost 17% reported symptoms of externalization, aggression, oppositionality. And another study of college age youth indicated higher rates of somatic symptoms, right? Almost 35%. Not feeling well, internally getting ill, feeling ill, particularly when worried about necessities of daily life. So I thought this might just be an interesting way to look at it. I will tell you briefly, I'm looking at my time I'm running out of time. That for a while in the hospitals, the emergency rooms, really nobody was coming at first, right? Everybody was afraid. And then they started to come. And what we have seen is that those who are coming are more acutely ill, and they've been suffering quite a while, and that they're needing hospitalization. So we are seeing that trend. Unfortunately, the system is overwhelmed, and waits for beds and treatment are quite long, and so the system is definitely stretched. So I thought that was an important thing to mention. Now let's quickly talk about substance abuse. I think every single one of us knows that as we live in this uncertain, and we continue as we continue to move forward in this uncertainty, in this ever evolving reality, those with addiction have really felt the impact of COVID, probably more than most, if I dare to say that. There's not a ton of 2022 data, unfortunately, I wasn't finding, but the most recent data really has been that Americans are reporting that they're increasing their substance use as a way of coping with stress and emotions related to COVID. Overdoses have spiked since the onset of the pandemic, and reporting shows that the early months of the pandemic brought an 18%, I'd probably say it's a little more now, an increase in nationwide overdoses compared to those with the same timeframes in 2019. The trend also has continued throughout 2020, according to the American Medical Association, that reported in December that more than 40 US states have seen increases in opioid-related mortality, along with ongoing concerns for those with substance use disorders. Again, several studies, including the CDC, have reported 31% of respondents increased anxiety and depression, 13 reporting increased substance use, 26% reporting stress-related symptoms, and 11% reporting serious thoughts of suicide in the past 30 days. That's a lot. Recent CDC surveys conducted then in 21 found that the results that they found in 20 were consistent, and that the percentages of adults with recent symptoms of anxiety and depression were as much as 41.5%. And so the data also suggested that the spike in substance use includes an increase in both quantity and the frequency of drug use during the pandemic. So some of these contributing factors I thought were important for us to take a look at. Some people who use substances may also have started new drugs if their usual substances became more difficult to access, right? Isolation, quarantine, couldn't get what they normally do, so perhaps something else was more accessible. Shifts in drug availability may also be to blame for increased illicit opioid use deaths. So if heroin isn't easy to access, someone might take fentanyl, which is again much stronger. Experts also agreed that based on research and clinical observation, pandemic-related strains from economic stress and loneliness, anxiety about the virus were major drivers of the increases, and that as stress increases, people may have fewer ways to manage it. So we hear about resilience promoting activities, right? We talked a little bit about it for kids. Physical activity, social interactions, they haven't been as safe to engage in or easy to access, which can lead some people to start using drugs or using them more often or in greater amounts to get through. People are also more likely to die when they're using drugs alone, right? Because there's no one there to call 911 or administer naloxone, which is the opioid reversal agent, I'm sure everybody knows. For those living alone during the pandemic, isolation presented this obvious risk. And it was way more difficult for people to seek the medical care they needed from recovery from opioid use or others, because the clinics and the community-based organizations decreased their services. You know, also support and self-help groups, right? They weren't in person, and until such time as people figured out how to connect electronically and remotely, those coping skills and those resources weren't available. So people who were already in recovery were having an even greater time finding and utilizing the supports that had worked for them. So the substance abuse population really had a very unique experience in the pandemic and as we move forward. So here's where I stop talking. And here's where we start looking from an integrated lens. What do we need going forward as a system, right? What does the data tell us? The pandemic has raised awareness of mental health symptoms and service needs, right? I think we can all agree that. I think we can also all agree that it's time to end the stigma around mental health and addiction and engage in these meaningful conversations and take action to care for ourselves and each other. And so the need for accessible mental health and substance misuse services for adults, children and families, and seniors, which are the population we're talking about today, but again, not the only ones in our service continuum. We talked a lot about other populations as well in form number one, but they've never been greater. So let's take a look at this from an integrated lens, okay? So I have a couple of slides, which I, can try to get through, but, let's start the conversation. What are the issues? I'm going to show you them so that you talk off the top of your head, right? So what are the issues and needs and trends that you're seeing within your organizations? Think about some of the challenges or some successes you're facing. When referring clients to other organizations, what are our barriers to access? Information sharing, we know that it's a barrier. Anybody have any lessons learned about sharing information easily? We could all use some tips on that. Have you had to reach out and establish new relationships with community providers to meet the needs of the clients you serve? How did it go? And how do we as a system stay connected? So those are the questions I pose to you and each other. How do we look at this? What do we need to do as a system?
So we have somebody, call NJ211 for referrals to mental health resources.
Great.
That's fine. So I'm going to chime in here because I think it's wonderful that Atlantic Health has really expanded their mental health services and residential programs. So for all of you on the call, if you weren't aware of that, Atlantic Health offers a lot of programs, but not to put anybody on the spot, I just want to give a shout out to someone who's on this call. Mary Ellen Zung, recently appointed to the board of Mental Health Association of Essex and Morris. She, as a member, she's an advisory committee member of the Morris County Chamber of Commerce Wellness Committee. And she and Dr. Jamie Pula and Lindsay DiStefano started Team DSTIG as an initiative to help Mental Health Association. And Mary Ellen has been out there in the community. If you ever see a yellow picnic table in Central Park or any of the open areas in Morris County, Mary Ellen Zung is the person behind that. So Mary Ellen, put some info in the chat if people want to attend your, get on your mailing list and attend the yellow table events and Team DSTIG mental health awareness. But I wanted to introduce you in front of an audience of 17 to each other today.
Great. Yeah. Thank you so much, Laura. Yeah. The yellow people's picnic tables. I think we've got another 20 rolling out this summer and into October. I know Christine, well, Susan's on the line. She's got a few that she's responsible for sponsoring. We are taking sponsorships for next summer, so we're full up for this summer, but we'll be doing more yellow tables next summer. So definitely, I'll put my contact information in the chat, and if you would like to be on our email list that goes out with the events, the paint parties, the ribbon cuttings, just to see what we're up to.
And they did one recently in honor of Sheriff Gannon, by the way.
Yeah.
One of
Yeah.
our favorite people in the world. And I'd be remiss if I didn't shout out that Amy Archer is on the call too, Mental Health and Addiction Services for the county. And I believe I introduced you already. And for those of you who don't know, Jen is the past Human Services Director for the County of Morris as well. So.
Great, thanks, Laura.
Sure. Does anybody have questions for Jennifer? I'm looking in the chat. So NJ211 is a great resource.
Yeah.
They're changing the number to 988. Good to know.
Yeah.
Morris County website.
Yeah. Also, the 988 is coming. I know somebody put that in there too. And here's a slide. that was my close that I.
So I have a question.
Laura, they're not changing the 211 to 988. It's a separate number.
That's what I was going to ask. Is it 211?
For
Okay.
lots of other resources.
So is that like strictly a mental health crisis response? Oh, thank you, Laura S. Not changing. Okay. Because you've got a lot of great branding there, you know. So, all right. What a wonderful, wonderful presentation, Jennifer. Does anybody else have any questions for Jen?
Or any suggestions, you know, how do we connect best? You know, what are the relationships that we need to build, or the structures that we need to build to, you know, bridge some of those gaps?
Well, I think being here today is a really great start, right?
Agree.
And we're going to be sharing it out. This presentation, which is being recorded, will be shared on the North Jersey Health Collaborative's YouTube channel and then posted on our website in our resource library along with the slides. And we will send out minutes from this meeting with the link to the slides, with the link to the YouTube video, as well as the resources that were mentioned throughout and put in the chat. And I'm just going to read one final thing. Samantha, you put something in the chat, but I don't see it. Would you like to just speak?
Oh, I was just answering Jennifer's question about how we can connect. And I think with the senior population, in-person outreach is always appreciated. Last week, we did a talk with Mount Arlington seniors on just self-care and emergency preparedness. And, you know, of course, you do it safely. We wore masks, but I think we've all kind of maybe gotten a little too comfortable with virtual. And we need to remember that the people who need it the most are probably not going to benefit from virtual. And we have to actually go out and do it. And it's a lot harder, but I think it's really important.
Samantha, I couldn't agree more with you. And I was remiss in saying that. I think you're spot on. Thanks for sharing.
Oh, thanks, Jennifer. I mean, virtual is great for people like us who we're technology literate and we benefit from it. But I think especially with the seniors, like they were saying, we really appreciate you guys actually coming out here and just having that face to face.
And I'll share, since my husband is the mayor of Mount Arlington and it's our senior club. They were really intent upon getting back in person and starting up. So a few months ago, they started up their meetings, and they need it. We all need it. We need to be in touch with people. So thank you, Samantha, for doing the great work.
They're a really active group. They're great.
Oh, the wife of the mayor of Jefferson just chimed in on the chat. So this is a little thing. Christine Will, Susan, and I are married to neighboring mayors. Thanks for this program. In person, in person, in person. We are not alone. It's so true, Christine. It's okay to not be okay. Lean on the supports in one another. And it is so true that we have to lean on each other. And that's what this collaborative is. We lean on each other professionally, but conversations like this that Jen opens up really, you know, shows us the human side of what we do and how our personal connections with each other are really beneficial, because even though we're leaders in our fields and in our communities, we have needs too. And community is everything. So thank you. We have 2 minutes left. And if Jen, if you have any last comments or questions or anything you want to share with us before we close.
I just want to thank you for the opportunity to come and do part 2. I couldn't be more proud to be part of coalitions like this and work alongside all of you. I think we're lucky to have a system where we all are collaboratively spirited, right? And so
Absolutely.
I think it's important for us to get through it together. So thank you.
Yeah, well, we have one final question.
Sure.
Laura, do you want to ask your question?
Hello, can you hear me?
Yes.
Hi, everyone. How are you today?
Hi.
Good.
So I just have a question in regards to what you were going over.
Mhm.
You had stated that there is a average wait time for beds in Atlantic Health.
So what I was referring to is that there's an average wait system-wide, not just
System-wide.
not
Okay.
just mental health. What I was suggesting is that a lot of times families are coming to the ER, the ED, and if their child is in need of hospitalization, a lot of the beds are filled. And so I want to prepare families a bit to know that sometimes there are waits longer than hours. So I couldn't tell you what that is because it vacillates hour to hour, day by day. But it really was to highlight that the needs are great and the system is at we have to be creative on how to serve and really try to maybe prevent children needing to be hospitalized if we could, but it's tough.
Right. And so
No.
these interventions in the community and, early signs,
Yeah.
just FYI, the symposium that I had mentioned earlier, Ruth Kolusky, if you know her, is the director of mental health first aid for Mental Health Association in New Jersey, Mental Health Association in New Jersey across the state. She's going to actually be presenting at our symposium on how you can get everybody in your organization trained in mental health first aid if you haven't already,
Yep.
which is a real, prevention is key. We know that. I know I'm using somebody's
Yep.
coined phrase, but
Yeah.
we've got to recognize the signs and symptoms out, before it becomes a full-blown mental health crisis, right?
Yep.
I'm very glad you said that, Laura.
Yeah,
Truly,
thank you.
because at NJ211, when people call, lots of times the either homeless or people who are on, addictions or things of that nature, it just seems like they'll say that they'll call. We have a certain protocol that we have to follow as well, but any information that we can put out there that would be of benefit to the community, that is information that we don't already have, is, we're always looking for.
Thank you. And please share them out with the collaborative. We will get them out across our network and support anything that any of you are doing in regard to mental health or community health. So thank you. So
I know we're over time, but the last thing I just want to say is that we have a LGBTQ plus a webinar tonight.
Oh,
It
nice.
is what is it called? Welcome to the conversation, and it's talking about LGBTQ identity and mental health, and really focusing in on how, what words do we use, how do we talk, how do we engage and let people know it's a safe space. So if you're interested.
Yes, and then one final thing. I know we're at time, but we could go on and on. But there's one final thing. Laura Berger from Center for Prevention just put in the chat. This is important. They've done mental health first aid for the schools and combined that, I guess, Laura, with anti-bullying campaigns, which is very critical because we all know that when you feel like you're on the outside and then you're bullied, in addition to that, we know what the serious consequences could be.
Yeah.
So thank you. So all this will get in the chat, and within the week, we'll have everything out to all of you. But
I'm sorry, I know Jen, would you be willing to go out and, like, I'm thinking of our older adult population and the programs that we do. Is it something that you'd be willing to go out and present to them?
It would depend. Yeah,
Okay.
wait, first who's speaking? I know
Oh,
that.
I'm
I know
sorry.
that voice.
This is Laura Berger from the Center for Prevention and Counseling.
Sure.
Yes.
Yeah, reach out to me because if it's not me, it could be somebody else.
Okay, great.
Yeah, so reach
Thank
out to
you.
me. Sure, of course.
Thank you so
Wonderful.
much.
Thank you all. Thank you all for being here today. We respect your time and appreciate all of you. And once again, Jen Carpenteri, thank you for being wonderful and being our face of mental health for Atlantic Health System.
Thanks so much.
Take care now. Bye-bye,
Bye,
everybody.
everybody.
Thank you.